Hi, my name is Charlotte, and I'm presenting my research proposal for the Community and Public Services Project module. My study, Understanding the Barriers to Accessing Sexual Health Services Among 16 to 24-year-olds in Plymouth, focus on exploring the barriers that young people face with the aim of providing evidence-based recommendations to improve accessibility and engagement. Sexual health, as defined by the World Health Organization, encompasses physical, emotional, and mental and social well-being in relation to sexuality. Access to sexual health services is vital for young people, supporting informed decision making, preventing unwanted pregnancies, and reducing the risk of sexually transmitted infections. It also contributes to the overall mental health and social development, with wider economic and social benefits for the community. Despite the availability of services, national data indicates that although utilization among under 25s is gradually recovering following the COVID-19 pandemic, attendance rates have not yet returned to pre-pandemic levels. This trend is mirrored locally at the Zone, Plymouth's primary youth sexual health provider, suggesting that barriers still prevent young people from accessing their care. My research seeks to explore these barriers in detail. The project has four main objectives, which are to identify key barriers young people face in accessing sexual health services, exploring how social media influences sexual health knowledge and behaviours, examine whether specific groups, such as those from deprived areas, face unique challenges, and provide evidence based recommendations to improve accessibility and engagement with sexual health services in Plymouth. The research questions will focus on what social, economic, and structural factors affect young people's access to sexual health services. How do stigma and social media misinformation influence engagement with these services? Which groups face the greatest barriers and why? And how can local services like the Zone improve access? The hypothesis for this research is that socio-economic disadvantage, social stigma, exposure to misinformation significantly reduce the likelihood that young people in Plymouth will access sexual health services. The literature review identified a number of intersecting barriers: social stigma, privacy concerns, limited awareness, financial constraints, and practical difficulties such as travel or clinic accessibility, all restricting engagement. Maslow's hierarchy of needs also provides a useful framework showing that when basic needs like food, shelter, and financial security are unmet, preventative health behaviours, such as seeking sexual health services, often become a lower priority. Research also indicates that COVID-19 and digital exclusion have exacerbated these inequalities, while misinformation on social media can further discourage for young people from accessing reliable services. To explore these issues, this study will adopt a quantitative deductive approach using structured questionnaires to collect data from approximately 100 young people in Plymouth. Participants will be recruited through the Zone and City College Plymouth. The questionnaire will cover demographics, barriers to accessing services, and sources of sexual health information. Data will be analysed using SPSS with descriptive and inferential statistics, including chi-square tests to identify significant associations between factors such as financial strain, digital exclusion, and service engagement. This study is significant because it addresses barriers affecting sexual health services among young people, specifically in Plymouth. Findings will help inform strategies for organisations such as the Zone and Plymouth City Council to enhance service delivery, promote equitable access, and improve outcomes for young people. Limitations include the use of convenience sampling and reliance on self-reported data, but these are mitigated by broadening recruitment and acknowledging the study's contextual constraints. Ethical considerations are central to this research, and participation will be voluntary, and informed consent will be obtained, and all responses will be anonymised and securely stored. Measures will also be in place to minimise potential support and potential emotional distress, with information provided on support services if required. In conclusion, this research will provide a valuable insight into how socioeconomic economic factors, stigma, and misinformation interact to influence young people's access to sexual health services, and will offer practical recommendations for improving accessibility, awareness, engagement. I would really value your feedback in this proposal, and you can provide it directly through my G site by either scanning the QR code or completing the dissertation proposal feedback form, or alternatively email me directly on this email address. And thank you very much for taking the time to listen to my presentation. Thank you.